Now this is a very interesting CT scan of the abdomen. Now why this is CT scan? Because this is the liver. This is the abdominal CT scan where on the right side we can see this is the liver, this is the spleen. Now it is very important to understand that the radial density of the liver is as equal as spleen. So you can simply compare this with this. This is the left-sided structure which is spleen, and this is the right-sided structure which is liver. And this structure in the anterior abdominal is stomach. Now why it is stomach? Because in the upper abdomen beside the spleen we have normally situated stomach, which has both food, water, and it is very commonly contains gas. So we know gas, which is this, is a dense black structure. The most dense black or radio opaque thing on CT scan is air. So we can see the air, and we know bone is the most dense white structure. After that, soft tissue has lesser dense white radio density, which is like liver. Liver is all made up of soft tissue. Spleen is made up of all soft tissue. So you can see this is much whiter compared to the air or the fat, but it is lesser white compared to the bone, which is very dense white. This dense white is bone. And the liquid or the fluid usually has lesser whiteness, or more of a, it is radio opaque or blackish structure, but it is not as black as air. So just see this, this is dense black, which is air, this is less black, and this is the density of fluid. So this is the structure which contains fluid and gas. It is present on the left side of the abdomen, and it is around in anterior abdomen towards the anterior part of the abdomen. So this is stomach. In this CT scan, what we'll be seeing is the kidneys. So the next structure to see is kidneys. So this is the left kidney and this is the right kidney. This is the left kidney and this is the right kidney, because R means right, L means left. So if you see the, this is a normal structure of the kidney, where the kidney is very clear cutly placed in the omental fat. Now this is all fat, this is all fat, this blackish structure is all fat. So this is blackishness of, or the radio opacity of the fat, and this is pretty well placed in around this fat. So if there is any inflammation, there will be fat stranding or very thin fibrous bands or streaks of whitishness can be seen in the fat, but here it is not at all there. Just see, this is the right kidney, this is the margin of the kidney, which is crystal clear and smooth. So the margin of the kidney is very smooth. There is no discontinuity in the margin of the kidney. It means that there is no pyelonephritis, or if there is any pyelonephritis, so the cortex involvement will be there, and automatically there can be irregularity in the cortex of the kidney, and there can be some thin fibrous bands which are infiltrating into the fat. So just compare this left kidney, this is the pelvis part. The pelvis part means the pelvic calyceal system through which the ureter arises. So this is the part of ureter. But on the right side, what we can see, there is a dense white structure. So we know this much of dense white structure is only always bone or calcium or blood. So calcium and the bone, they are the most dense white structure, and in this just in the center of the right kidney we can see a dense white structure, very well defined. It means ki this is a renal stone. This is the kidney stone which is actually impacting the calyceal system. You can simply trace the same stone in this area also. You can see the dense white structure, and you can see the dense white structure It is it is a renal calculi which is actually blocking the pelvic calyceal system. So this is kind of upper ureteric calculi which is there in the pelvic calyceal system, and it is causing blockage of the right kidney tract. So how you can see that is it is causing blockage is just compare the left kidney and the right kidney. See, I have already told this is stomach, this is air of the stomach, and this is the fluid in the stomach. So this is the fluid in the stomach. Just see the radio opacity of this. This is kind of blackish structure. You can again see this is the bladder. This is the bladder in the pelvis, and this is all filled with urine. So this is all fluid. So this is the bladder, this is the urine, this is the radio opacity of the liquid. The same radio opacity of the liquid is seen here. So this is the right kidney, but on the left there is not any fluid radio opacity on the left kidney, in the left kidney, because there is no any accumulation of the urine. In the right sided kidney there is accumulation of the urine, because the urine is not able to pass down, because there is an obstruction by the upper ureteric calculi. So this calculi is not letting the urine pass down. That is the reason why there is obstruction. That is the reason why there is hydronephrosis. That is accumulation of urine into the kidney. That is called hydronephrosis. We call it as hydroureter if this is seen in ureter. But we know in here the urine is only visible in kidney. It is not visible outside the kidney. So if it is visualized in outside the kidney, we can label it as hydroureter, but there is not much prominent hydroureter. It is all in the kidney itself, because in here, see, this hydro there is not much accumulation of urine in this side. So this is all accumulation of urine into the kidney only, and not in the ureter. So this is kind of hydronephrosis with almost no hydroureter. The second thing is, when we zoom in, the other things which I need to tell you, ki hydronephrosis can be mild, can be moderate, and can be severe hydronephrosis. In severe hydronephrosis, there will be thinning of renal cortex. The renal cortex, or the cortex of the kidney, will be very, 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 very thin. But here the kidney cortex is pretty good. So the kidney cortex has pretty good thickness, and it is almost as thick as of the left side. So it is not at all a severe hydronephrosis. To call it as moderate, there should be more accumulation of the urine, so that there will be uh, reduction of the renal cortex. But in this case there is no much reduction of the renal cortex, so this is not moderate hydronephrosis as well. So this is a very mild hydronephrosis because of the obstructive calculi present in upper urinary calyceal system, without any much hydronephrosis. And thank you.